Welcome, Mountain Mamas, to this month's Zoom meeting, Zoom training. We're doing for first aid, the bites, stings, and burns, which none of them are fun at all. So a lot of this stuff you may be familiar with, but we've got some just extra tips and pointers and things like that that might be kind of helpful as we're going into the spring and summer. And I feel like some of this is going to be inevitable. I'm going to get stung and bit and burned by something. I've already been sunburned. So yeah, so these are just good tips that'll be good for you to kind of brush up on. We take our first aid information from this book, The Backcountry First Aid and Extended Care by Buck Tilton. This is the same book, just we have a bigger textbook that we use for wilderness first responder courses. So that's our text for today, but I'm going to be going through it. First off, we're going to talk about bites and stings. So first, small bites, mosquito bites, black flies, gnats, and things like that. They're just miserable. So the best way to prevent is going to have thick clothing that they can't bite through. Wearing lighter colors, I've heard. This is going to be random, but when I went to the Amazon, this is what they recommended, that you had light colored long sleeve shirts and pants that were thick, soak them in permethrin. And it seemed to work for the most part. So if it works down there, it can work here. If you are going to be plagued by bugs, going to places that are going to be plagued by bugs and things like that, that's something to consider at least, or get like a permethrin spray. Of course, insect repellents as well are, if you want to make sure that they cover mosquitoes, gnats, bites, yeah, all the little things that you're going to be exposed to, that's fairly important. And of course, avoid dusk and dawn. I haven't slept a lot in a hammock, but you can get hammocks with mosquito netting. And then you can also have tents all our tents now have mosquito netting. So anyway, the treatment is for mosquitoes, we want to wipe with a Sting Ease or similar sting relief product for pain. I actually, one of our gals, Lisa Jones, gave me a thing. It's called Sting Kill. It's like a little green vial with a little cotton. You just punch it and break it, and then you can just rub it on. I believe that's the name of it. Anyway, she says it's amazing. So they're called Sting Kill disposable swabs. You can get them on Amazon or anything like that. So that's great. And then also, if it's bad or you're concerned, go ahead and use Benadryl or diphenhydramine is the other name for it, for itching, and that'll help. So mosquito bites. All right, next, bee stings. These are the worst, and these can happen in the mountains. This can happen at home, wherever. The most important thing is we know it's a bee or a hornet. If it's a bee, then we need to get that stinger out. And getting it out with tweezers is not a good idea, because the idea is that if you see that little stinger in your arm and you grab the tweezers, it's attached to like a poison sac, and you can squeeze that and it'll just continue to provide more irritation. So the best thing is if you've got a little credit card or something similar and you get under there and you just flick it off, that works the best. And I've done this. So yeah, I highly recommend that as kind of a way to get the stinger out. And then of course you want to put ice on it, because that's going to constrict those blood vessels and keep that from just spreading. And then monitor for an allergic reaction. I don't know any of our gals that have allergies to bees, and I would think as an adult, you'd know by now, but you should know that if you haven't had any bee stings, the first time you're stung, you're not going to have the reaction, but it's going to happen the second or third time. So you want to kind of be aware of that. And especially if any of you guys are guides, if anyone has a bee sting, we want to just still keep an eye on them, even if unless they've been stung a lot during their life. And they're like, I'm pretty sure I don't have an allergy, but still keep an eye on them. All right, number 3, we've got spider bites. Spider bites. I have only been bitten by a wolf spider. Luckily, those aren't poisonous. Back when I was a kid and collected spiders, I don't know if anyone else did that. But anyway, so the 2 big ones we need to worry about here in Utah are black widows and brown recluses. Those are the ones that we're most concerned about, at least. The black widows, they're super easy to identify. Black, shiny, the red hourglass shape on their back. The things that we need to worry about is if you see somebody one of your gals gets bitten, what we're going to notice is localized pain and redness within 10 to 60 minutes. And then they're going to start having muscle pain and cramping. If it gets worse, they're going to notice sweating, chills, nausea, vomiting, headaches, that kind of stuff. And that just kind of slowly progresses. You can have arm and leg muscle cramping depending on where you got bit, or abdominal pain, cramping and things if it was in the abdominal area. The treatment essentially is to clean the area, apply an ice pack. The ice pack is gonna prevent spread of the venom as well, and then take some sort of painkiller, Tylenol, ibuprofen, whatever like that. And usually you'll be recovered within 24 hours. But that would still be something, if we saw that someone was bit by a black widow, we would probably still recommend they get out of our activity, they evacuate, and we have them go see a doctor just for further evaluation. And the second kind of spider is brown recluse, also known as a fiddleback because they're brown and the back of them has a little shape on their abdomen, shaped like a violin. And I've seen these enough times to be concerned. Mostly in our home, what we see are wolf spiders, and they look very similar. On the wolf spider's legs, you'll notice they're about the same shape, but the wolf spider legs have black stripes on them. And of course, they don't have the violin. Unfortunately, I find those things about the time that I squished them and killed them. So I'm sorry for all the wolf spiders I've killed, but I just never want to take a chance. But if you get bit, you'll also be the same as a black widow. You have localized pain. You'll actually start having a blister within 1 to 5 hours. And then they're going to notice a bullseye discoloration that's going to happen around that bite. And then what happens is that blister opens up and ulcerates, and it just becomes this oozy, nasty thing that can become really bad. We had a downstairs neighbor at my mom and dad's house, and he got bit on the forehead and didn't think it was anything. And it just had surgery, and it was like this bad. It was super, super bad. So these can get really nasty and infected. So if you feel like you got bit and you're noticing a blister or it's starting to get bad, definitely go see a doctor for something like that. Take some pain medication as well. And then you're going to notice fevering, chills, weakness, are some of this progressive symptoms. So what we'll do for treatment is we're going to clean. It's going to be the same for the black widow, similar. Clean it, ice pack it to prevent that poison from spreading, and then take painkiller medications. And then if it ulcerates, then we want to clean it like a regular wound and apply a bandage and things like that. And then, have them go see a doctor. So spider bites in the mountains and things like that, just something we got to watch out for. So just keep an eye on it. That was my IT guy. Anyway, it's good to see all you ladies, by the way. Okay, now we're going to move on to scorpion bites. Now, luckily, we don't have such a big concern about that in central northern Utah. In southern Utah, I think deep southern Utah, we might have some concerns. I've never been bitten by a scorpion or stung. Those of you gals from Arizona, New Mexico, and all that kind of stuff, you guys, Nevada, may have a lot more experience with this. But if we're ever in an area where we feel like someone had a scorpion sting, they're going to notice immediate pain and swelling. And then the difference with them is it's going to be numb. And that's a common symptom of a scorpion bite. So numbness around the sting site. What we're going to do for that is we're going to do the same thing. We'll clean that area, apply an ice pack, take Benadryl. If it's painful, then we can have them take an ibuprofen or Tylenol or something like that. There is a caveat to this. There is a kind of scorpion. It's called a centroid bite. It's a different kind of scorpion. If someone gets bit by this kind of a scorpion, and I don't know if we have these in Utah, I haven't heard anything, but they're going to notice anxiety, sweating, salivation, GI, just tummy distress, and have a hard time breathing. So I would say if you're starting to notice something, they're just not looking good outside of just having that numbness around the site, get them out as soon as possible, because that respiratory distress is something we're super concerned about. So that's an immediate evacuation if we ever notice that. All right, on to ticks. Ticks, we've already had problems with this on one of our hikes recently. So this is something we need to keep an eye on with our ladies. The first thing is we want to prevent ticks as much as we can. There are insect repellents that have tick spray. And I would say if you are doing any of our hikes, especially down in the valleys, you're going to be hiking through lots of sagebrush and scrub oak and stuff like that. That's perfect tick country. And apparently it's warm enough for them now. So that's something to kind of keep on your radar. Do a quick spray of that before you head out on your clothes. Don't let them bury into your skin. Obviously, we don't want to let that happen, but it's a good thing to just kind of do a quick check. If you wear lighter colored clothing, colored clothing. That's really helpful because you can see them a lot better. I lived in Tennessee for a while and you get crazy big ticks out there. And so this is something we would actually really do, is like wear lighter color clothing, do a tick check twice a day, especially if you're going to be doing hikes that are going to be through, that aren't like on a wide trail. Like you're going to be hiking through, you've got a lot of brush that's kind of rubbing on you and things like that. So twice a day tick checks. And this involves, as you all know, ticks love the warm, safe, moist areas. So those are the ones that we really got to do a check on. So you want to check scalp, of course, armpits, down the groin area. But I've had them crawling all over. So yeah, just a quick tick check. You want to check your body, all that kind of stuff. And just make sure that, yeah, that you're covered. I've been up in the hills, and the Wasatch Hills mountains will still get them. Up in Camas area, I was camping and I think we noticed like 2 ticks in our tent and was crawling on us and things like that, but none of them were embedded. So if they don't embed, you're okay. And that's something that we really want to watch out for. If you notice a tick gets embedded in you, you want to remove it as soon as possible. You'll know they've been in a while because they get huge. They start at really, really small and flat. And then the longer they're in you, then they get bigger and bigger and bigger. The worst ones I've ever seen are on animals because they can't get them off. And so you'll know it's been on there for a while. So hopefully you can catch these little buggers when they're small and get them out. The way to get the tick out is that when we do use our tweezers, and we're going to try and grab the tick as close to the skin as you can get, because what you're trying to do is get their head. They're like little burrowing mouthpieces and all that kind of stuff. You want to get all of that out. So you're going to get the tweezers really close and then pull it straight. That's important, pulling it straight. And then you want to check that area again to make sure like that you got everything and that there's nothing still left in there. So yeah, that's kind of the trick to do that. If you actually pull off a little bit of the skin, that is a good sign that you've got the head. So that's what you want to do. Then you want to make sure that we keep the tick. If you've got a little Ziploc bag, if you're near a residential area, tape works really good. I've taped them to like paper and things like that. But yeah, something where you're going to be able to keep an eye on it just in case it ends up being a tick that has Lyme disease or Rocky Mountain spotted fever, or any of those the illnesses and diseases that they cause. So you just want to kind of hold on to that tick. Just in case, yeah, someone starts to have nausea, vomiting, just progressive symptoms, weakness and muscle aches and things like that, that would indicate that there might be something that was an infectious bite. And then of course, we're going to wash the wound and then watch for fevers and rashes. If we start noticing fevers and rashes or progressive symptoms, obviously we want to evacuate that person. Otherwise, we just kind of keep an eye on them and make sure things are doing okay. All right, next, snakes. This never happened to us, but who knows? Luckily in Utah, we are super lucky. We only have rattlesnakes, the diamondback rattlesnake, and it's actually a very shy rattlesnake as far as snakes go. So it's not going to want to bug you if you don't bug it. So if you're hiking, we've seen these mostly in the foothills, I think, of our Wasatch Mountains, some in the desert, but I think, we've seen them in both areas. But if you hear that little rattle, just kind of keep your eyes open, step away and just give it a wide berth. And then you should know that there's a snake called the gopher snake that looks just like a rattlesnake, only it doesn't have the rattle at the end. They're not poisonous. So we just don't want to go killing snakes. You don't want to kill a rattlesnake either. I don't know. It's a wild animal. And I'm just of the opinion that it was just freaked out and it was just scared. So we just leave it alone. And, I'm not after vengefulness, but anyway, we've noticed some gopher snakes at Diamond Fork Hot Springs, the Fifth Water Hot Springs, but I've never noticed rattlesnakes out there. But I'm afraid a lot of those gophers get chomped, because people are afraid they're rattlesnakes. That being said, there has been reports of rattlesnakes that don't have rattles, but that's pretty rare. So anyway, that's usually the telltale sign is you're going to hear that rattle. You're going to see the kind of the black diamond pattern on their backs and things like that. But yeah, they usually are pretty shy and kind of want to leave you alone. But if we had some issue where someone was bit, they're going to notice localized pain and swelling within about 15 to 30 minutes. Now it's possible snakes do things called dry bites, where they'll just hit you, but they don't release their venom because their venom is it's hard for them to manufacture. So if they feel like they can just kind of freak you out and get you away, they're not going to, and if they are able to control that, they're not going to, yeah, envenomate you. Anyway, so if you notice 15 to 30 minutes swelling and pain, then it's likely that you've had a strike. If you don't notice that after about 30 minutes, like nothing, no pain, no swelling, it's likely, yeah, you just had a dry bite. So that's good to know. After the pain and the swelling, you're going to notice blisters, discoloration of that site, the lip tingling sometimes, a funny taste in your mouth within about an hour, weakness, chills, nausea, muscle twitch, and then muscle twitching is possible, but rare. And then of course, death is possible, but also rare. It depends on how much that venom gets into your system. So obviously this is something we want to evacuate somebody for if we feel like they had a bite. So we want to get away from the snake, number one. We want to remain calm, because the whole idea with poison is once it gets into your bloodstream, if we are moving hard, running or excited, or, all this kind of stuff, our heart's beating faster and it's pumping that blood everywhere. And then that venom can get in more parts of our body that we don't want it to be. So we want us and our whoever has been our patient, I guess, to remain calm. Remove anything that could be constrictive. If it was on a finger or something, you would want to remove rings, bracelets, things like that, because it's going to start, their limb or whatever is going to start to swell. And once it starts swelling, you can't get things off, and then it starts to cut off circulation. So just keep an eye on that. We want to wash off the bite area and then splint it, just to remind the person not to move it. We want to keep it as immobile as possible. We don't want as much, we want to just limit as much keep the blood circulation nice and calm. And then keep it level with the heart. So that'll kind of keep it from, getting too much spread. And then we need to be transporting this person. The best situation is to carry somebody if it's possible, especially if it's a leg bite, and which they most often are. But they can walk out slowly, but it'll be a slow walk out. So just remember, we're going to do everything with a rattlesnake bite that we can to keep people calm and just chill. And we're going to get them help as soon as possible, but in a nice, chill manner. So anyway, the things we don't do, you guys probably know all these, but we want to they can have Tylenol for pain, but not ibuprofen. Ibuprofen or aspirin are blood thinners, and that helps the venom spread. So no ibuprofen, no cold packs, no tourniquets, no cutting, no sucking, and no electrical shocks. I didn't know that was a thing, but apparently it is. So anyway, none of that stuff. All right, our last bite we're going to cover is rabies. Now, I don't know anyone who's had rabies. Maybe some of you guys who've traveled the world in third world countries had experience with rabies bites, but they are lethal eventually. So this is something you just want to have on your radar. They can come from mammals that have teeth. We got bats, raccoons, foxes, skunks, dogs, coyotes, cats. Your biggest indicator is this animal is acting abnormal, and that is a judgment call. But anyway, but if you have any sort of animal bite out in the mountains, that's something that you're going to want to get evaluated when you come off your excursion, your hike or whatever. You definitely want to wash that wound as aggressively as you can with soap if you've got it, and then keep the wound open actually and allow it to drain, and then get to the hospital. If the infection reaches the brain, that is when it can be lethal. So I would think if you were out in the mountains and you were bit by something, like animals out in the mountains just don't do that. Like that would be a really crazy animal. They're always terrified of us. So, that would be something I would be very concerned. Something comes out of the woods and just goes crazy and bites you. Like I'd probably get that checked out soon. But anyway, and then of course, like if you are on trips or places where there are wild dogs and cats and whatever that are monkeys running around, and you get bit by any of those, for sure, you're going to want to get checked out for that. So anyway, that's bites and stings. Yay, lots of fun. Now we're going to go into burns. Burns, I have... Luckily, my own experience has just been first degree burns, but I've had some experience as a nurse with other burns. So the first thing you're going to do is if someone has been burned, you want to remove them from the source of the burn. Obviously, if it's a fire or a chemical, Those are the two big ones that I can think of: electrical burns, things like that. So you want to take them away from that source that's burning them, and then stop the burning process. So if it's a fire, obviously we're going to put out the fire. If it's chemicals that are on them, we want to wash the chemicals off. We just need to, if you're able to stop that burning process within 30 seconds, you have a lot, it's a lot better, obviously. They'll have a lot more success in healing and things like that. So that's your goal. You want to cool it if it was a fire burn. Cool off the temperature. If somebody has melted tar or plastic on them, don't try and remove that. Can cause more damage. So we don't want to be doing that. And then this is the critical thing with burns, is if there has been if you suspect any burn there's been any burning in the mouth, the airway, it's very, very concerning. If there's any burns on the face, neck, soot in the nose, like black soot, like they've been breathing in the nose, mouth, singed facial hair, dry cough, those kind of things that would indicate that they inhaled smoke or anything that they could have burns there. That is an immediate evacuation, and you need to get them help as soon as possible, because what happens is it's burned and then your body freaks out and it starts to inflame those tissues, and that will, like, their throat and everything starts to swell up and it just closes off their airway. Honestly, paramedics, if anyone's had a burn, they try and intubate even if that person is conscious, because the likelihood that they're going to lose that airway is very high. So anyway, so any burns here, you get them out. They need help immediately. Then as far as evaluation of our burns, we've got 3 levels. So you could call them your first, second, and third degree. We can also call them superficial, partial thickness, and full thickness. This is also what we'll call them today. So a superficial burn, this is kind of like your sunburns and things like that. And it can happen with chemicals or anything like that, but you're going to notice the skin is red, it's painful and swollen. And that swelling can stay there for a while. If you've got a partial thickness burn, you're going to have those same symptoms, only then you have blisters on top of that. So that means that's not just affected the top layers of skin, but it's gone a little bit deeper. Now we have blisters, and you'll get blisters up to an hour after you've cooled the skin. So if you're noticing blisters on anyone who's been burned, whether it was at the fire or I don't know what chemicals we find in the mountains, but something like that. If someone's got blisters, just kind of keep an eye on them. And then a full thickness burn is going to be the skin has no pain. They've burned that skin so far, it's burned the pain receptors, so they don't work anymore. So, and the skin doesn't have the ability to blister. And you'll notice the skin is pale and charred. It can have a waxy feeling, black, all those kind of things, like dark, thick type of skin tissue. So that obviously is an evacuation, and it doesn't matter how much of your body has been burned. We definitely, if that happens, someone got burned on the campfire and it's black, and we are definitely sending you to the hospital as soon as possible. So, so those are your kind of 3 levels of burns. The thing to be considering with the burns as well is you may have someone who has just a partial thickness burn, but they have it on a portion of their body, like significant amounts of their body have blisters. That would be concerning. They have something, it's the percentage of amount of, like, the more your body has been burned, the bigger the concern is. The most important thing that we're concerned is if you have a 15 palms, so this is the size of your palm, and you can get online and kind of really get into the nitty gritty of, this side, if you have 2 arms burned or 2 legs burned or your head, or your just know that if you're burned, we're going to take care of you and get you home and get you to the hospital. Like, we're not going to worry about percentages. You're just going to look at your patient and your lady and just go, we just need to get you out. And most likely, if it's not something that's just on an arm and it's small, we're definitely getting you out. So as far as treatment, we want to wash the burn area with soap and pat it dry. If it's a superficial burn, there's an awesome cream called Armor Gel Wound Dressing Gel. It's a silver, and it works awesome for burns, superficial burns. and wounds too. The silver acts as an antibiotic, antibacterial. So it can also help with any bacterial and could probably work on partial thickness burns as well, using some caution. But yeah, if we have blisters and the blisters have ruptured, then we also want to remove that dead skin and clean that area, that wound bed. It's going to be really painful. But we want to make sure those areas are cleaned, and then put some antibiotic ointment, like I mentioned, on there, and cover with a non-stick gauze or clean clothing. Kind of depends on what you have. The book actually recommends putting just straight on gauze on a burn. And I will tell you, that's so painful to remove. So if you have something that's not draining a lot, then use that non-stick bandaging. It's called Telfa. It's the same thing that you'll notice just like in a regular Band-Aid, you know, that white part, it's shiny. It doesn't absorb. It's not like cotton or something like that. It just absorbs just a little bit, but it's non-stick. That's helpful. But if you have a bandage or a wound that is draining a lot, then you would want to have, you know, more absorbent dressings on that, of course. Of course, if you don't have anything, clothing is just good, clean clothing that you just can use to protect that wound as well. And then no ice packs, which I thought was interesting. But yeah, no ice packs. We don't want to cause, the part of this is mostly because a lot of the pain receptors and your sensation receptors have been damaged. And so your body's not going to be able to tell if it's being burned from cold. Like you can get, like if you keep ice on too long, it can cause damage to the skin. So we don't want to do that either. So no ice packs, but we want to elevate your extremities higher than the heart. And that will help keep the swelling down. Because that's, you know, we talked about that. That's something that your body's going to do, is freak out and add fluid to whatever that burn is. And then taking ibuprofen is okay for this. And if you're in a situation where you have no dressings, nothing that you can use for this wound, then you want to clean it and then actually let it dry. This would be out if you were out somewhere for days or things like that. But the burns will actually form their own scabs and provide a natural bandage. So that's okay. You just want to make sure you keep that area clean. And then of course, keep your patients warm and hydrated as well. That's going to be some secondary effects that are going to be coming on with that. So then of course, evacuation. If someone has a sunburn, we're going to say, throw on some aloe vera, take some ibuprofen, let's keep you in the shade and hydrated. And, you know, depending on how much of their body got burned, of course. But then things start progressing into partial thickness and full thickness burns with blistering and of course charring and things like that. We want to definitely be considering evacuation. If you can do evacuation within the day, then whatever dressing you put on there is good and just get them out. If you're going to be somewhere for multiple days before they can get out, then you actually are going to want to change the dressings on those burns twice a day. And it's lots of no fun. So you're going to want to give them painkillers as much as they can tolerate. Well, they can probably they'll probably tell you they'll take a ton, but you know, as much as they can safely take, definitely give them that about a half hour to about an hour before you do your bandage changing. And then you want to get clean water and soak those dressings as much as you can, and really let them just get nice and moist. So when you pull that off, it's not going to be tearing away skin or anything like that. It'll be as comfortable as possible with that. So, and then of course, rapid evacuations, like we talked about, anytime the airway is affected at all, you are pushing that SOS button and we are getting somebody out as fast as possible. Also rapid evacuation, if anyone has a burn around something, because what that's going to do is it's going to start swelling and then it's going to start cutting off circulation to hands and things, or extremities, whatever is on the end of that. We want to watch out that. And then of course, anything, if there's a full thickness burn, that's 5 palms in size is what they recommend in the book. So that'd be like 5 hands, you know, or sorry, not 5, 15. But honestly, I'll tell you, if someone's got, I mean, that would be a rapid evacuation and you would notice, you're like, there's a large part of this person that's charred and we're definitely pushing SOS and getting them out of here, even if it's not on the face, you know. But that is something, yeah, that is our other advisement. So anyway, that is bites, stings, and burns. Do any of you ladies have questions? We're good. We're good. Excellent. All right. Well, thank you so much for joining us tonight for our first aid skills course, and have a wonderful day, and we will see you later.